Thank you all for coming out in spite of the snow. So I feel like you should get like extra bonus points for like braving the cold to get here. So thank you for that. As Phyllis was saying, the title of my talk is Infertility Finds All the Weak Spots, which is actually a quote from one of our participants that I'll get to later. Effects of infertility on women's mental, physical, and relational functioning. So first of all, before I get started, I have to acknowledge the people without whom this project would not be possible, namely my graduate and undergraduate students, Rebecca, Gabrielle, and Madison, and then my undergraduate students, Stephanie, Brittany, Morgan, and Emily. So thank you to them, some of whom are here today, so thank you. So let me just start out by telling you a little bit about infertility in general. So first of all, why study infertility? Well, for me, when I was in graduate school, I was in a lab that primarily looked at trauma, especially sexual victimization, but broadly traumatic experiences and women's health. And for a class paper, we had to research a topic in health psychology, kind of the role of the psychologist. And so thinking about this umbrella topic of women's health, I settled on infertility because it was something I didn't know a lot about, and it seemed like a ripe area for psychologists to be involved. And in my research for that, came across a quote from an article that wrote that 40% of women who had been through the experience of infertility described it as the most distressing or upsetting experience of their life. So obviously coming from a trauma-informed perspective, that was really impactful for me, and I thought that that was so interesting. And so it was one of those things that really got me interested in this field. So it's kind of that overlap between trauma and reproductive health, in this case infertility. So when we talk about infertility, what are we talking about? So infertility medically is defined as the inability to conceive after a year of unprotected timed intercourse for women who are under the age of 35. For women over the age of 35, it's after 6 months of unprotected intercourse. And what we say when we mean timed intercourse is intercourse that happens during the few days a month that a woman is actually fertile. There's also a differentiation between primary and secondary infertility. Primary infertility refers to women who have never born a live child, whereas secondary infertility refers to women who have a living child and are trying to conceive a second or third or fourth child. So that's kind of what we're talking about. How about prevalence? How common is this? Well, 12% of women aged 15 to 45 have been diagnosed with infertility or meet the medical definition of infertility, according to CDC data from 2016. That may be higher than some of you may have thought. So this is a relatively common problem. And 12% of women within that age range have sought some type of treatment for infertility, which relates to 7.3 million women in the US. So again, this is a very widespread problem that we were talking about. This is not a health condition that only affects a very few number of people. And I thought so that was CDC data. There's also more recent data from the Pew Research Center that I thought was really interesting, especially presenting to an academic audience here, that 33% of American adults report that they or someone they know has been affected by fertility difficulties. So about a third of people have either experienced it or know someone who has. However, if you look at individuals who hold a postgraduate degree, that number goes up to 56%. So more than half of people who hold a postgraduate degree have either been impacted by infertility or know someone who has. So looking at those numbers, we can kind of guess that even if this was not a topic you had ever thought about before today, this is likely a topic that influences perhaps you or someone you know. In fact, we all know at least one person who has been through the process of infertility and IVF, which is Michelle Obama. I don't know if anybody has read the book Becoming, but in this book she talks about her own struggles with infertility and conceiving her children through IVF. And there's a quote that I just love from this book, that is, two committed go-getters with a deep love and a robust work ethic cannot will themselves into being pregnant. And I think one of the things that's so difficult sometimes about this process of infertility is that it kind of doesn't matter how hard you work, how dedicated you are, what you do. It's one of those things where you can kind of do everything right and still not achieve the outcome that you're hoping for. I also liked this quote because it reminded me of the following quote from one of our study participants, which was, "It is hard to share a dream and not be able to fulfill it." I'll tell you, the women in this study had some of the most impactful, poignant quotes. There will be many more later on, but I was just really impressed reading through it at their ability to kind of put words to this experience. So when we talk a little bit about infertility treatments, what are we talking about? There are two major types of assisted reproductive technology, or ART, IUI, or intrauterine insemination, and IVF, or in vitro fertilization. For those of you who can't see the little onesie over there, it's a little onesie that says, made with lots of love and a little bit of science, which I like. So IUI differs from IVF in that in IUI, the male partner's semen are inserted into the uterus, but there's no retrieval of egg, there's nothing that happens kind of external to the body. It's just that you're putting the semen exactly where it needs to go, so you're hoping to increase the chances of conception by kind of shortening that distance a little bit and having good timing and medications and other things. IVF involves a process of actually stimulating with hormones for several weeks. There's lots of medications involved. Having an egg retrieval process where they actually go in and kind of get the eggs and bring them out. And then they specifically fertilize that egg with the male partner's semen or male donor semen, sometimes through a process called ICSI, where they actually pick out one little sperm and inject that one directly down into the egg. Then they allow these fertilized embryos to grow a few more cells and develop for a few more days, at which point they'll either freeze them for a later transfer or go ahead and transfer the embryos back into the woman's body, into the uterus, or of course in a different woman's body in the case of surrogacy. And then about 14 days, 2 weeks after the transfer, you're able to take a pregnancy test to see if you achieved a positive result. So how often does this result in a positive outcome? So infertility, IVF specifically, has come a long way since our first test tube baby, baby Louise Brown in 1978, who was the first baby born through in vitro fertilization. But it's still not a perfect science. So when you look here at the column on the far left, which is women under the age of 35, so sort of that lowest risk group where we might expect to see the best outcomes, the live birth rate after one cycle of IVF is still only 40%. So when we're going through that whole process of lots of medications, going through surgeries, the egg retrieval, the transfer, all of that, for a 40% chance of success of a live birth, which of course means that more often than not, greater than 50% does not result in a live birth. And of course, this process is very burdensome to go through, both from a medical, psychological, and financial standpoint. So medically, a lot of these medications carry side effects. Of course, you can imagine if you are putting lots of new hormones into your body that your body is not necessarily used to and didn't make itself, one can imagine how that might result in you not feeling your best. So things like headaches, dizziness, mood swings, hot flashes, vision changes are all common on these medications. Of course, the biggest risk of fertility medications or assisted reproductive technology is the case of multiple births, so twins or triplets, which might sound really good, like a good outcome for people who are trying to achieve a pregnancy, but actually, of course, any case of twins or triplets carries more health risk for both baby and mother. There's more complications associated with a multiples pregnancy. There's also a risk of something called ovarian hyperstimulation syndrome, or OHSS, where the ovaries, because they've been stimulated to grow so much and make lots of eggs for several weeks, get large and tender, and in some cases that syndrome can actually result in hospitalization, where you're retaining a lot of fluid, can have effects on the kidneys and kind of the rest of your organs as well. In very rare cases, it can lead to death. If you experience OHSS, you're also at risk for ovarian torsion, which is when one of your ovaries becomes so large and kind of out of place that it twists, and it can kind of cut off the fallopian tube, and you'll need surgery to correct that. Of course, these are very low chances of developing these more serious side effects. The financial burden of IVF is also extremely notable. The average cost of a cycle of IVF is between $12,000 and $15,000, plus between $3,000 and $6,000 for medications, plus between $3,000 and $6,000 if you do genetic testing on the embryos, which some people choose to do, particularly if they've experienced multiple miscarriages in the past and they want to rule out the chance of a genetic problem contributing to recurrent miscarriages. And for a lot of individuals, that cost is completely out of pocket. Insurance does not cover any of that. In fact, when you look at insurance coverage, there are only 15 states in the US that mandate infertility coverage. Tennessee is not one of them. And they're kind of all over a little bit. But so these are the only 15 states that have to offer any type of insurance coverage for infertility. For the remainder of the states, it's all out of pocket. So you guys can imagine, of course, spending that amount of money with a 40% chance of success. There's a really great documentary called Vegas Baby about a fertility clinic in Vegas. And one of the nurses in that documentary used the analogy of it's like going to spend money on a car, a nice car, $20,000 car, but you go and you pay the car dealership and they're like, great, thank you for the $20,000. There's a 40% chance we will give you a car. Most of us would probably say, no deal. That does not sound like a good deal. So this can be very burdensome financially as well as medically. So for the current study, so this was all kind of what led up to this interest in this area. This is a very burdensome experience to go through. And coming especially from a trauma lens where I'm very interested in exploring these stressful life experiences and how that affects health and mental health across the lifespan. I was really interested to dig a little bit deeper into this. So the objectives of the current study were to evaluate the medical and psychological burden of infertility, to explore predictors of infertility stigma, or the effect to which women feel stigmatized by the experience of infertility, and to investigate women's perceptions of how their experience of infertility has affected their romantic relationships, if at all. So we used social media to recruit. I don't know if anybody's familiar with the website Reddit, but we used that as a platform for posting our survey, just for like an anonymous online survey. So anybody who saw the study posted and who met our eligibility criteria of being a woman between the ages of 18 and 50 could complete the study. And so as a result, we got women from all across the globe. We had women from 29 different countries who completed the survey. And the way that Reddit works is that it's organized by topics of interest. So there are subreddits, these topic groups that people will organize that are related to any hobbies or news events or geographic regions or life experiences or kind of whatever. And so we posted the study on subreddit specifically about trying to conceive, infertility, pregnancy, parenting, and other subreddits, kind of general women's interest subreddits as well. So part of this is that I'm presenting only on kind of a one pie piece of the study about infertility. We also have information, data from this study on experiences of pregnancy and parenting and breastfeeding and things like that that are also interesting, so stay tuned. We gave participants an incentive of one $75 gift card that we raffled off, an Amazon gift card. And I want to just kind of put in a plug for this process for any researchers in the room. I had never used social media to recruit, wasn't really sure what to expect, how it would go. After, I think, something like 4 days was the first time after posting it that I logged back in to check how many responses we had. And we had something like 400 and some responses, and I was just like, oh my gosh, what is happening? We ended up getting over 1,200 women who began our survey. So we have at least partial data on 1,200 women and 800 or 900 women who had finished the entire survey. So really quick data collection process, and the participants seem to be engaging pretty conscientiously, really paying attention to the items, actually reading them, and writing in qualitative responses, as you'll see. So it's a good experience. I support Reddit recruitment for if you guys do online anonymous surveys. So the participants in the study, as I mentioned, we got over 1,200 women who began the survey. And I want to take a moment to just mention the choice to only include women in this survey. So for some of the experiences, such as pregnancy, of course it makes sense that a female population would be more relevant. For infertility, however, I want to be very clear that the experience of infertility also very much affects men, whether they are in a partnered relationship and is their female partner who's going through some of the medical interventions and things like that. And that's when I get to future research, that's something I'll kind of come back to, because this is certainly a process that affects men as well. But just sort of given the large scope of the project, this particular study, we chose to focus just on women. So of the 1,200 women who are currently experiencing medical infertility were 343, so pretty good sample size. And there were a larger number of women than that, 603, who were currently trying to conceive but had not yet met that kind of definition of infertility. Mean age was 30, 76% of them were US residents, whereas the remaining 24% were from other countries. They were 78% heterosexual, 89% Caucasian. Most, about 40%, reported an income between $100,000 and $200,000, and also about 40% reported achieving a bachelor's degree. So fairly well-educated, well-off, SES-wise sample. Also not very diverse in terms of ethnicity, which is unfortunate. So these are the countries that were represented in our study. So you can see we kind of got a spattering from all over, except for Africa. We didn't have any representation from there. And of course, for some of these studies, or for some of these countries, we only had like maybe one participant from that particular country. So there wasn't really anything that we could do in terms of like, I wonder if the experience of infertility is different in Croatia, because we only had one Croatian participant. But I do think it's interesting just to kind of look at that big picture of where participants were coming from. So moving a little bit into the results, I want to start off with the quantitative results, and then we'll move into some qualitative stuff. So in terms of just looking at medical burden of the women in our study, first I looked at the number of medications that women were on. So the mean was not that high, only 1.3. On average, they were only on one medication. But the range is interesting, that women reported being on between 0 and 18 medications. I don't know if anybody in this room has ever tried to take a medication every day, whether it's a vitamin or whatever, multivitamin. It is really difficult to remember. So imagine taking 18 medications a day, some with food, some without food, some in the morning, some in the evening. So even just kind of medication adherence can be difficult. The number of methods they were using to track ovulation ranged between 0 and 6. So if you guys aren't sure what I mean by that, there's a couple ways of tracking when a woman ovulates. So women can take their temperature every morning and get their basal body temperature, or BBT. They can track the positioning of their cervix or their cervical mucus. Or they can look at the ferning of spit from a cheek swab. Or they can use an app to track their period and kind of their cycle that way. So there's a lot of different things people can do. I only had 6 options because I can only think of 6 things that people might use to track ovulation. So people were doing between 0 or all of the methods of tracking. And when you think about things like taking your temperature every day, might seem kind of really small, only takes a few seconds, but it's yet another thing to do every day in addition to taking medication. Similarly, I asked women how many different diagnostic procedures or tests they and or their partner had undergone. So these would be things like blood work, semen analysis, or some more kind of invasive procedures like an HSG or laparoscopic surgery. And the mean number of diagnostic procedures was 4.3. So in general, these women had gone through some testing, or their partners had gone through some testing. And the range, again, was 0 to 10. 10 was the most. And so there was a lot of burden in terms of seeking an answer, going through medical tests, going through procedures, and trying to kind of find answers. When you looked at what percentage of them had gone through either an IUI or an IVF, 9% of the sample reported having had an IUI, and 7.6% of the sample reported going through an IVF. The number of IUIs ranged from 0 to 11, as did the number of IVFs. So that whole elaborate process that I was talking about before of taking medication for several weeks and having surgery and waiting for the eggs to grow or not grow and then having surgery again and then waiting to see if it happened. Some people have been through that 11 times. Also, when you think about the financial burden, if we're imagining it costs about $20,000 a cycle, of course, some of these women may have come who had maybe 11 cycles of IVF, may have come from states or countries where they had some insurance coverage. Let's hope so. Otherwise, that can get to be very burdensome, right? So that's kind of the medical burden. And just the kind of takeaway from here is there's a lot of different things to think about, things to do, a lot of salience of this experience for women on a daily basis. So they're taking medications, they're making doctor's appointments, they're tracking their ovulation, they're doing whatever. And so that's just kind of starts to paint this picture of increased medical burden. In terms of psychological burden, so I looked at a few different outcomes. One was depression, and I used the PHQ-9, or Patient Health Questionnaire 9, to look at depressive symptoms in the past 2 weeks. And I did find that women with infertility reported statistically significantly more depressive symptoms than women without infertility in the survey. I do want to point out it wasn't particularly high anyway. There was a significant difference, but even for women with infertility, the mean depression score was only 8.3 or something, which is in the mild range for depression. So in general, we're still just talking about mild depression, although we did have a range across the whole range of possible answers on the PHQ-9. So still kind of in that mild range regardless, but women with infertility did report statistically more depression. They also reported statistically more anxiety, which we measured with the Generalized Anxiety Disorder 7 questionnaire, or GAD-7. And finally, they reported lower resilience. So this idea of resilience is this ability to bounce back after adversity. So the questions are things like, I can overcome when bad things happen to me, and things like that. That's just a 6-item questionnaire. The brief resilience scale was the one that we used. And women did report statistically lower resilience in the infertility condition. So the women who had experienced infertility viewed themselves as less able to sort of overcome life's adversity, which was interesting, and we'll talk about again later. So kind of some continued outcomes for psychological burden. I also looked at self-esteem and relationship functioning. And kind of fortunately on a humanistic level, maybe less good for research, but did not find any significant differences here. So women who had experienced infertility did not report any significantly different self-esteem. You can see it's a little bit lower, but again, it's not significant. And they did not report any worse relationship functioning than women who had not experienced infertility, which is really interesting, and I think the qualitative data speaks to that even more directly. So not an entirely grim picture here that we're painting. Some outcomes where they differed and some where they did not. I also looked at sexual functioning of women in the sample. And for this, I used the Female Sexual Functioning Index, which is a very widely used sexual functioning measure in the field. Did find that women with infertility reported significantly worse or lower sexual functioning than women without infertility. So in this case, scores on this, the higher the better. Higher scores correlate to better sexual functioning. So there was significantly worse among women with infertility. And you can also break it down by domain. So the FSFI looks at 6 domains of sexual functioning: desire, arousal, lubrication, orgasm, satisfaction, and pain. And there were significant differences in all of these domains except for orgasm, as kind of indicated with those little stars over the tops of the bars. So no differences in orgasm. So maybe that's a good thing. Also, pain was just barely significant. So just kind of to get a broad picture of that. Certainly you can understand why, and you can see it more in the qualitative data as well, why the focus on infertility, perhaps having to have timed sex, things like that, why that might result in worse sexual functioning. Another piece that I was really interested to look at is this idea of infertility stigma. So how stigmatized did women in the sample feel by this experience of infertility? So there's not an infertility stigma scale specifically that would be appropriate for this study in this population, but there's a stigma consciousness questionnaire which had been adapted in previous work to look at infertility. So that was what we used for this study. It includes items like stereotypes about women with infertility have not affected me personally. Most people without fertility difficulties do not judge women on the basis of their infertility. And my having fertility difficulties does not influence how people interact with me. So these are reverse scored so that the higher scores mean more stigma. So kind of the opposite of what the questions sound like. So if people scored higher on the infertility stigma scale, they felt like stereotypes about women with infertility had affected them personally, for example. So those were reverse scored. So I wanted to see what factors can predict infertility stigma, so the likelihood of feeling stigmatized by your experience. And really most of our medical burden questionnaire items ended up predicting infertility stigma. So infertility stigma was significantly predicted by the length of time that somebody had been trying to conceive, the number of medications they were currently taking, the number of strategies that they were using to track ovulation, the number of diagnostic tests or procedures they had undergone, and whether or not they had had an IUI or an IVF. Those all significantly predicted feeling more stigmatized. And so I think that that's really interesting, that medical burden piece we're talking about, where there's just like multiple things a day you have to think about and remember to do and call the doctors and pick up the medications and do all these things. That kind of medical burden piece seemed to result in feeling more stigma. Interestingly, stigma was not predicted by how old the women were, whether they were in the US or not. And again, we couldn't look at which country they came from, but just sort of whether they were in the US or not, yes or no. Whether they had explained or unexplained infertility, so about 40% of women with infertility, there's no known cause. So there's not like one diagnosis that a doctor can point to and be like, this is why you are having trouble conceiving. So it's just sort of in this unexplained camp, which, as you might imagine, can be very challenging and confusing and frustrating, but did not result in more stigma. And I also looked at whether the number of IUIs or the number of IVFs they had been through predicted infertility stigma, and it did not. So it seemed to be more about whether you had had this experience or not resulted in feeling more stigmatized, but then the number of times you had been through it didn't matter quite as much. And so one thing to think about is sort of, why do we care? So why is infertility stigma a bad thing? I also found that it resulted in predicting several of our mental health outcomes. So the more infertility stigma you felt, the more stigmatized you felt by your infertility experience, the more depression and anxiety that you reported, and the less resilience and self-esteem. So feeling more stigmatized made people more depressed and anxious, and made them report lower self-esteem and resilience, that ability to bounce back from adversity. So clearly the stigma piece seems to be a really important piece of the puzzle here, and something that when I get to the future directions, I'll talk a little bit more about. Okay, so let's move into some of the qualitative results. So we asked women this question: do you believe that your experience with fertility issues has affected your relationship? Yes or no question. And 71% of participants said yes, they did feel that their experience with infertility had affected their relationship. And so that was 260 women in our sample who were experiencing infertility and said yes to that question. And then for those people who said yes to that question, we asked a follow-up: please describe how you feel that your experience with infertility has affected your relationship. And then we ended up with women wrote a bunch of different responses to that. Some of them were super short. Some of them were even one word. Some people just wrote stronger. And some people, I think one person just wrote stress. And then some people wrote quite a bit more. They had much more, they had a pretty wide margin of how much they could write if they chose. So the first thing that we did was to code their response into generally positive tone to the statement, generally negative tone to the statement, or sort of a mixed positive and negative tone to the statement. And I thought this was so interesting because there's so much research on like infertility is terrible, infertility is stressful, infertility is traumatic. And yeah, that seemed to be true. Even the women who, most of the women in the sample wrote about how challenging or stressful or difficult it was. But 40% of their responses had a generally positive tone about their experience of infertility on their relationship. Now, about half of them, 47%, reported a negative tone, which is, I think, something we would predict based on the literature. And about 13% had a mixed positive and negative tone. So they might have said things like, well, it was really challenging and hard, but it also brought us closer in the end, something like that. So then that was kind of the overall picture. We also broke it down into some overall themes that emerged from the responses. And one thing that I was so struck by and thought was so interesting was that 38% of the women in the sample reported that the experience of infertility brought them closer or made their relationship stronger. And remember, it was just a very open-ended question in terms of how has it affected your relationship. And so and the language around this tended to be pretty consistent as well, which was so interesting. So about 38% reported that it brought them closer or made their relationship stronger. About 14% mentioned being a team with their partner or like getting through this challenging experience together. We worked through it together. And you can kind of look at some of the other responses there. There was mention of providing support to one another. Kind of on the other hand, there was mention of being on different pages, like, well, he or she wants this, but I want this. We disagreed about this. I wanted kids more than they did, or they wanted kids more than I did. Sort of that idea of just like being on different pages. Mentioned it being challenging, acknowledging that they and their partner might have different emotional reactions to the experience and that was difficult sometimes. About 5% reported that the feelings about it were dynamic, that they might have felt about one way about it at one time and then ended up feeling differently about it later. Mention of financial stress or burden, or having to make lots of decisions around finances, treatment, logistics, things like that. So I always enjoy including some actual quotes from participants when talking about qualitative data. So here's a few. This is the one that inspired the title of the talk today. Infertility finds all the weak spots. 4 miscarriages and a lot of failed IVF ripped our hearts out. We are healing. This participant wrote, it was our first really tough situation to face together. We felt like it was us against the world. No one else in our lives understood what we were going through. It made us so much closer. It especially made me feel secure in the fact that he will always be there for me no matter what. People wrote, it's much stronger. We've been through some fires. And then this person, I thought it was very poignant. I have failed to provide what most women can, children. This person wrote, infertility is all-encompassing. It affects our romantic life, what career choices we make, what car we buy, everything. And then this person, very similar vein, had sort of a funny reaction to the question, what does this even mean? It affects every single aspect of our life together. Budgeting, planning, deciding where to live, renting or buying, whether or not to attend family events, whether or not to travel, literally everything. So when we talk about that piece earlier about kind of burden and this being something that you have to think about a lot and make decisions about a lot and that's very salient for participants, I think these final 2 quotes especially really kind of speak to that. Communication was a theme that emerged as well. And some of the, so we coded if they mentioned communication at all, so any positive or negative effect on communication. And 28% of people reported something about communication in their responses to that question. 14% reported it had a positive effect on communication, whereas 12% reported that it had a negative effect. So that's kind of interesting, right? That more people reported a positive effect on communication than a negative effect. People also reported having fights about infertility treatment or being forced to have hard conversations, and so therefore being open and honest with one another. And that's kind of what this person wrote. I think it's made our relationship stronger and forced us to be even more open and honest with each other. And this person's a whole chunk, and I know especially you guys in the back can't see that. So it says, extremely tough decisions, deciding how much we could let treatment tank our finances. Took some time to be on the same page about whether to go forward with IVF, given additional financial, logistical, and emotional impacts with no guarantees of a live child. Partner was considering stopping when I was not ready to give up. This was one of the only times we have ever questioned if we could stay together forever and give each other what we needed. There were also a lot of mention of this affecting one's mood or emotions. General negative mood was reported in about 46%, so almost half of the responses reported something about general negative mood words. 15% reported some stress, and you can kind of see from there. We also had a little bit of sadness, depression, frustration, grief, anxiety, worry, low self-worth, resentment, etc. So some of the quotes here. This person wrote, "Still coming to terms with it. Soul crushing on the inside, smiling facade on the outside." Again, I'm telling you, these women were like really good writers and like good at putting very poignant words to their experience, I thought. This person wrote, "It is stressful. We are spending all this money on things we don't think will work. Sex has become a chore. The miscarriages have hurt my mental health quite a bit, which then hurts our relationship." And this last person wrote, "I don't feel like a woman anymore. I cry. I feel depressed." So we also looked at sexual effects. Several women wrote about the effects of infertility on their sexual relationship, which again makes sense when you're considering that sex is usually an important part of conceiving a child. About 14% mentioned sex at all. People also wrote about the increased pressure on sex or having to have timed sex, sex becoming a chore or mechanical or not fun, decreased sexual drive or desire, or the male partner having difficulty performing due to pressure, although those last few came up just very little bit. One person wrote, "I don't want sex anymore. I'm depressed. I no longer feel like a woman." One person wrote, "Creates huge strain and creates changes to intimacy, just having timed sex." This person wrote, my husband prefers to be in the dark about fertile weeks, does not perform well under pressure. I feel discouraged when we cannot complete intercourse." And this last one was the only person who said this, but I had to throw it up here because I thought it was just such a great perspective. This person wrote, "I oddly think that it has made us stronger than before. We pulled together through our issues and have learned more about our bodies than ever before. Our sex life is better than ever. Since we figured we had to have sex so much, we figured we might as well make it as fun and not mechanical or necessary." So I thought, good for you. Figured if we're going to be having all this sex, we might as well make it fun. However, that is the only person who reported sort of that perspective on it. But that leads really well into kind of talking about some of the implications and take-home points of the study, because the first one is kind of this idea of resilience. So we asked about resilience specifically, and women with infertility reported significantly lower resilience, at least that they saw in themselves. But throughout a lot of these quotes, and you guys, of course, have only seen a few of the 260 that we coded, but I think several of them really speak to this idea of resilience or kind of finding a silver lining or finding like strength through adversity. And so I thought it was interesting that they saw themselves as being less resilient, having lower resilience, but just reading through all the responses, it seems to be something that kind of clearly jumps off the page at you. So I thought that dichotomy was kind of interesting. As I mentioned before, even though there was a significant difference in depression between women with infertility and without infertility, depression was still only mild, so this was not a severely depressed sample, at least this sample that completed our study. And also of note, there were many more positive effects in these results than are necessarily reflected in the literature. So some studies have, for example, have failed to find a difference in relationship satisfaction, as we did, similar to our study, for couples experiencing infertility. But they haven't really focused as much on kind of those positive or resiliency aspects that came out in the study. So I think that that's a really interesting addition to the literature here. Also, this idea of stigma. Of course, as we mentioned, that increased medical burden seems to be associated with the feelings of stigmatization, and the feelings of stigma consequently seem to lead to worse mental health outcomes. So that seems like something that is really important to be aware of, perhaps for providers to consider when they're seeing women with infertility. So for OBGYNs or reproductive endocrinologists, REs, who are typically, that's the specialization that typically goes through the IUI, IVF, fertility process, for example. So perhaps OBGYNs and REs should be more aware of the mental health effects of infertility and then screen appropriately, so screening for anxiety or depression among women attending their clinic. And also, as Dr. Thompson mentioned, I work in an integrated care setting 1 day a week. I think that this is a great indication for the need of integrated care, and having maybe behavioral health consultants in these clinics, like OBGYN clinics or RE clinics, where they're not typically as integrated as primary care is fortunately becoming, biased, but, and so I think that there's a really neat niche, really neat opportunity here for extending behavioral health services to these types of clinics, given the psychological burden that we're seeing in their patient population. For future directions of research, as I mentioned, I think it's also important to explore what this experience is like for men, or for partners in same-sex relationships, the partner who's not going through the bulk of the medical intervention. I think that that would be a really interesting piece, or looking at dyads together, so the couple together and their experiences and their thoughts about it. I do think that, and I haven't looked at this yet, but in both our qualitative and our quantitative results, I wonder if there will be a difference among people who went through an experience of infertility but then successfully conceived a child versus people who are still childless, are still struggling to conceive, are still sort of right in the middle of it. And I wonder if some of those resiliency kind of themes that came out are people in hindsight, looking back on the experience now. Would love to dive deeper into this idea of infertility stigma. I just got really interested in this. I think that there's good reason to think it might be higher for minority participants, for example. One really interesting, as Dr. Thompson mentioned, one of my areas of interest is in health disparities, and infertility and reproductive health in general is such an important issue with health disparities in the US. African American women are more likely to experience infertility and are significantly less likely to be referred to fertility testing and treatment. And so there's a really large disparity there that I'd love to explore a little bit more. I also wonder about the infertility stigma from participants in different countries. Of course, we all know that cultural norms around families and having children vary country to country. And we couldn't look at it by country in this sample because we didn't have enough participants necessarily from any one country, but I think that would be really fascinating to do in the future. Also, again, looking at the experience of stigma for men. And then possibly creation of a scale, since that's something that seems to be needed in the literature. And then finally, clinical research into interventions to support women and couples experiencing infertility. This is something that I'd love to kind of get off the ground, get going, even in this region, in terms of a group therapy program for women or couples experiencing infertility with all my free time. So that's something I'd like to try and find time for. And that's all I have. And we have a little bit of time, I think, for questions. So I'd love to hear from you guys what your thoughts or reactions are. Yes?
One of your quotes, the woman referred to having had multiple miscarriages and then failed fertility tests. And it may be one of two things. One, is there a correlation between miscarriages and infertility? And the other one would be, and is there a cumulative effect? I would think there would be a cumulative effect. It would be especially disheartening.
Yeah, so I'm going to answer your question with a caveat that I'm not a medical doctor, and so I'm not sure exactly. I do believe having one miscarriage raises your possibility of having a future one a little bit. Of course, miscarriage, is something I didn't even really talk about much in this sample, although we do have some of that information in this data set. And I do think the two often go hand in hand. Whether or not miscarriage is correlated with infertility tends to depend on the infertility diagnosis. And of course, sometimes it's unexplained, but sometimes there is a known diagnosis that causes infertility and also makes people more likely to experience miscarriages. But it just kind of depends. Thank you for the question. Yeah?
I know you touched on it in your future studies,
Mm-hmm.
but did you find any exceptional variation between the emotional responses between heterosexual relationships and same-sex relationships?
So I have not broken that down yet and looked at that. I would love to do that. We didn't have a ton of variability. I mean, about 78% of the sample was heterosexual. And so I'd have to look at what that N is for our sexual minority participants and see if that's even large enough to really kind of draw any conclusions about. But I'd love to look at that and see what I would, if I had to guess, I would guess that anybody who is a member of a marginalized identity, so a sexual or gender minority or a racial minority, who's also experiencing another marginalized life experience, infertility, that there would be sort of an additive effect of stigma, that kind of intersectionality of multiple experiences. So I do think that would be really interesting to look at. Any other questions? All right, well, thank you guys again. I hope you all are able to get out home through the snow.